Speaking of low fertilization, what is the cause of low fertilization?
Yes, so in terms of low fertilization, you can have a just simple low fertilization that's 75 to 25% fertilized of mature, or very low fertilization, which means less than 25% fertilized, or failed fertilization, none of the mature eggs fertilized. Let us say you got 10 mature, 15 total eggs, 10 mature eggs, 8 fertilized, that's normal. Or if you have got like 8 to 3, 3 to 8 fertilized, that's low fertilization. So if you have got only 2 fertilized, that's very low fertilization out of 10, which is 20% fertilization. That's very low. If none of the mature eggs fertilized, that's called failed fertilization. You don't have any embryo to grow. So, and depending on level of fertilization, you can have a different causes. So generally, the fertilization of mature eggs is a function of sperm. Generally, it's sperm's role to fertilize mature eggs. When fertilization is low, generally we assume that's actually sperm quality or quantity or binding to the egg was problem. So generally, but of course I will explain some situation. Actually, it may be mainly due to egg maturation, or maybe due to egg quality as well. So generally, that's sperm. So in terms of low fertilization, first thing we'll look at is whether we did IVF or ICSI. If we did IVF, we look at the binding of eggs and sperm onto the eggs. So when you do IVF, next morning when you check, you should see a lot of sperm bound to the surface of the eggs, and hopefully one sperm entered, and you have 2 p.m. So if you have, if you see a lot of very good binding and still low fertilization, it may be due to egg quality, sperm quality. Sperm might have been healthy enough to bind, talk to the eggs, but didn't have a capacity to fertilize the egg. That's very likely cause. Then we look at the sperm parameters or male factor, previous baseline sperm analysis, and try and understand if there was a significant issue with the sperm quality. So, and the second reason may be due to egg maturation. So eggs may be mature, which is M2, nucleus of the egg may be mature, but the cytoplasm may not be mature. So which means if egg looks mature when we look at the microscope, but it doesn't have a capacity to accept the sperm and create fertilized egg or embryo. So this usually we can tell by looking at the monitoring chart. We look at the size of the follicles at the time of trigger, estrogen levels, and if the size of the follicles were too small, then we assume that in this patient actually they need extra time for maturation next cycle. Or if there's a sign of FSH or LH receptor problems, despite having good size follicles, good estrogen, you can still have immature eggs. Then you need to change the stimulation protocol, use different FSH, different trigger, longer stimulation, maybe change of regime to improve the maturation of the eggs, and as a result to improve also quality of the eggs and capacity of eggs to accept the sperm. So in the blanket rule, just in generalization, we assume it's usually a sperm's problem, but it can be due to egg maturation or even egg quality problem. It can be due to egg quality problem if, especially in patients, in older age patients, where eggs, due to poor quality, they can't handle the stress of fertilization. So they do not have a very good capacity to go through the, because fertilization is a critical milestone. That's phase transition in the eggs, and that may be too stressful for poor quality eggs to go through. So yeah, so we looking at the chart and overall background history, baseline fertility, normally we are able to tell what could be the reason for low fertilization.